Hi.
Hello, my name is Dylan. I'm the pharmacist here. What is your name?
Goldie Rush.
Goldie Rush. Hello, Goldie Rush. Nice to
Hi.
meet you.
You too.
All right, so I see that the doctor sent over, Dr. Brian sent over a new prescription for you today. I just want to take a few minutes to talk about your new medication with you today. It'll take about 5 minutes, and we'll go over it and make sure you have all the information, and so that it's as safe and effective for you as possible. So why don't we go ahead and have a seat?
Okay.
All right, Goldie, before we get started, like I said, my name is Dylan. I just want to go over a few things. So is this the, can you please verify the address, the birthday, phone number, and allergies that we have on file?
That's correct.
All right, thank you. And the second question I always like to ask all my patients is, how are you doing today?
I'm okay.
You're okay?
Yeah.
All right, yeah, I just want to make sure that I can anticipate any concerns or frustrations that you have before going over this medication today.
Okay.
So Dr. Brian sent over Compazine, which is the brand name for prochlorperazine. It's a big, long name, but we'll get that down for you. And it is a 10 milligram tablet. And what did the doctor tell you this medication's for?
To use if I feel nauseous after my chemotherapy.
Yeah, this is a really common one for that use. A lot of times the chemotherapy might make you nauseous. And do you mind me asking what type of cancer are they treating you for?
They said stage 2B breast cancer.
2B breast cancer, man.
Yeah.
Yeah, we're definitely rooting for you on this one. You're a fighter. You can definitely kick this, and we're right here with you. We're rooting for you. But with this one, we want to make sure that you feel as comfortable as possible during your treatment. So with this one, it will help with the nausea and the vomiting after your treatment.
Okay.
So the directions is 1 tablet by mouth 3 to 4 times daily as needed. And you can take this with or without the Zofran, depending on if you need it. How did the doctor tell you to take this medication?
Well, normally I would take my Zofran, but if it doesn't work, then I could take one of those.
Yep, yeah, absolutely. And what did the doctor tell you to expect when taking this medication?
That it should help with the nauseousness if I even need it.
Yeah, that's hopefully you won't need it. Hopefully the treatments aren't that bad, but we do want to make sure that you're comfortable during your treatment, and so that you can focus on fighting the cancer and kicking it right in the butt. So like I said, yeah, this is the Compazine. A couple warnings that I want to make sure you're aware of. They're more serious, but they're not as common, but I want to make sure you're aware of them.
Okay.
It's called dyskinesia, which is a really fancy term for like kind of muscle jerkiness or muscle movements that might not be voluntary. So if you do experience any of those, definitely reach out to us or give your doctor a call. And then more of the maybe common side effects that usually go away with time might be some dizziness or drowsiness. So if you're driving or you're operating anything, make sure you see how this drug affects you beforehand. And if you miss a dose, this one's as needed, so you might not technically miss a dose per se. It's kind of used as needed for that one. Where do you store your medications?
Kitchen cabinet.
Perfect, yeah, very good place. You want to avoid heat and moisture, so like it's out of the bathroom, so kitchen cabinet is really good. And Dr. Brian did send over 3 refills for you, so depending on the duration of your treatment, you'll have refills for this to hopefully lessen the side effects of the chemo treatment. And one other thing that we do have for you here is a couple. So what does your support system look like at home?
There's no support system at home, but I have 3 kids that are close by.
All right, are they helping you through this? Because it's a lot to go through alone, so I just want to make sure that we can help you as much as we can and support you. There is some information that I'll give you right here as well with some local support groups for you that you can definitely go to, get connected with. It's a lot easier to go through it when you have support and someone beside you to help you through it, and we don't want to see you go through this alone. So we're definitely rooting for you. We're fighting with you. You can definitely do this. Well, just to make sure I covered everything, what did we talk about today with your medication?
That I just take it if I need it, up to 3 to 4 times a day.
Yep, and just to summarize, if you have any dizziness or drowsiness, those should subside, but if you have any muscle jerkiness or anything like that, you definitely want to give Dr. Brian a call.
Okay.
And so you do have 3 refills. Here's the bottle. Our number is right at the top. Definitely give us a call if you have any questions at all, if it's about your medication, if it's just about your treatment, or you just need someone to talk to, definitely give us a call. But yeah, like these resources that I gave you, definitely utilize those as well. And we want you to have the best support system possible. So if you have any questions, what other questions do you have for me?
None at this time. I
All
just
right.
have to wait and see what happens.
Sounds great, Goldie. We're rooting for you. Best of luck, and hang in there.
Thank you.
Yep, have a great day.